We just brought our third baby home and had to introduce him to his big siblings. And maybe you're wondering, are there any tips or tricks that we've used to help make this as smooth as possible? Full disclosure, it wasn't perfect, but here's the things we thought about.
If this is your first time meeting us, I'm Sarah. I'm a board-certified OBGYN.
I'm Kurt. I'm a board-certified pediatrician, now dad of 3.
Yeah,
and we are the Doctors Bjorkman. Welcome back. We're going to take the next couple of minutes to really talk about introducing a new baby to their big siblings. And we're going to talk about it through a couple of different standpoints of kind of things you can do to prepare while pregnant, what to do to prepare for that big event, the actual meeting, what we did at the moment of introduction, and then finally kind of things that we've done in the early days and weeks to really try to help improve bonding between new baby and big siblings.
Yeah. So thoughts are like, okay, we're pregnant. When do we share that with older siblings?
Hank's joining for this
Yes,
episode.
Hank is joining because he wasn't going to nap on his own. So, some of the thoughts are, it depends on how old your little kids are. Our 2-year-old has a very different comprehension of what the almost 4-year-old can get. And so some of the thought is, hey, why don't you tell your kiddos when you start to show? So that helps with a little bit more tangible, hey, mommy has a belly, mom's pregnant, there's a baby in the belly. That is a fine time to share.
Of course, if your kids are older,
right.
You can tell them sooner.
The flip side there is So miscarriage is common, 1 in 4 clinically recognized pregnancies. So that is most common. That highest risk of miscarriage is kind of in the first trimester, first 8 to 10 weeks. And so sometimes people want to wait to get beyond that so that they don't have to necessarily share a miscarriage and processing that with a little person. Totally up to you, but that's sort of thoughts on timeline. Or if you're super sick, like you have horrible morning sickness or you're exhausted or different things, you might want to say, Mom's sick because I'm pregnant, or I need a nap because I'm growing a new baby, whatever. That's some thoughts on.
Yeah, and so depending on your family dynamic is going to kind of depend on when are you actually going to tell.
Yes.
But then once we started to tell our kids, I think you were probably second trimester for Hank, and maybe second, third for when Bo was coming. Cease was younger and just kind of you were physically showing more.
Yep.
But we really made it a point to prepare. How do we do that? We got things like books. There's a lot of great little books that we can try to put in our show notes too that we thought were nice about, hey, new sibling coming home.
Yep. Cease is a big sibling. Baby cries a lot.
Yep.
All these new babies being born on the farm, like different animals. And my mom got her a book about before Bo was born, about Cease is a big sister to Bo, or when I am 5 and you are 3, or whatever. So just lots of books, lots of talking about it.
Yep. And then this time around, now that Cecilia is almost 4, a lot of tell me all about it. Wants to know all of the little details. And so some of that is how old is your kid? What kind of things are they ready for? But we found talking, preparing for it has been really helpful.
Yep. She has been telling everybody she got to hold the baby first. Her comprehension of this baby than when her little Bo was born has been totally different. She just gets it. With Bo, we'd say, hey, Cease, who's your best buddy? And she'd say Bo. But, the 2-year-old doesn't quite comprehend what's coming.
Yep.
So,
and then as you're getting closer to the date, then it's kind of what kind of expectations? How do you set expectations? And I think one piece that's really important is things not to do. Things not to do. Not making big, drastic changes. Bringing a new baby is a major just stress point. Even though it's a lot of positive stress, is a stress point to everyone in the family. And so, maybe it's not a great time to think about potty training or going to a toddler bed or getting rid of a passy right before. Because generally the rule of thumb is not to do that within 3 months because you're a lot more likely to have a lot of regression.
Yep.
Having said that, we potty trained Cecilia when we brought Bo home, and it was just
On
like
maternity leave, yeah.
because we were both home, it worked for us. So like sometimes like life just happens.
Right.
Maybe they're gonna have to start preschool,
Yeah,
but if you
it's
can
just what it
avoid
is.
big things, it helps.
Yep, totally.
I think another thing not to do is not to like put a lot of stress on them, like
Or
in terms
pressure,
of pressure,
responsibility.
responsibility. Like sometimes it's fun to say, "Oh, you can help with diaper changes, you can do these," but it's things they can do, not a thing they're gonna have to.
Right.
And like, oh, you're gonna have to set a big example. You're gonna have to step up around
You have
here.
to teach babies so much. Like, no,
Yeah.
don't. This is not
Yeah.
on them.
They can do it. They don't have to.
Yes,
I think is helpful.
The flip side of that is talking about our baby and things we are doing, and this is
Absolutely.
our family and our new baby and all these things. So they feel very involved and not like it's mom's baby or it's dad's baby or this other. You want to try to include them as much as you possibly can.
Yeah, because there's this natural feeling like you are going to have to spend so much energy on this new baby, and like jealousy, envy is going to be natural. So as much as you can make it say like, oh, this baby is our baby.
Yep,
Like,
our baby's tiny, our baby's sleepy.
your little brother, your little sister.
Yep.
So those kind of words that rather than, and then I think along those lines too, not blaming the baby for things
Right.
like, and we'll get to that in a little bit more too, but just things to think about.
Yep.
Any other big prep things?
Like telling them early how they can touch the baby.
Great.
You cannot pick the baby up by yourself. You need an adult. You cannot hold the baby by yourself. And you don't use that language that I'm using. Like you can't. You say, mom has to help you hold the baby. Mom has to help you carry the baby. The baby has to stay laying in their bassinet. They're toddlers. They're total vectors of germs and disease. So we say, hey, try not to touch the baby's hands. Don't touch the baby's face. You can kiss him on his head. You can kiss him on his arm. You can touch his clothes. We're, again, trying to keep them out of his face and off his hands in case he puts his hands in his mouth are kind of the big things we focus on. You can kiss the baby's head. This positive language is something that we work on ahead of time.
Okay.
You have to wash your hands before you touch the baby. Things like that.
So you've done all this prep during pregnancy. Then the thought is, hey, it's time to prep for the actual meeting. What are some things you can do like in the direct days before? And so the first is letting them know why you're going to the hospital.
Yeah.
Hey, we're going to get your baby brother. We're going to get your baby sister so they know.
You're going to stay with grandma and grandpa for mom and dad are going to be gone for 2 sleeps because we're going to get baby brother.
Yeah.
Things like that.
And then something that we did that we got advice from, I forget where we heard this from, we actually had our older kids buy a present for the new baby.
Yep.
And then they also got a little present too, right? So it was, hey, baby's birthday, let's get him a birthday present. And like they got a present too, just as like a something, again, trying to say like, oh, it's not all about the baby.
Yeah.
It's about our family growing.
Yes.
And then again, allow them to have something special to give to the baby
So
when
fun.
baby comes
They
home.
picked him out this little dino outfit, and they got him these little dino toys because they're obsessed with dinosaurs right now. And I think that's something to keep in mind. Like, I cannot, so many times people would get a present for the new baby. Here's a new outfit for the baby. I'd bring another bag, a goodie bag home from work for the baby. And it's really easy for the big siblings to be like, oh, well, the baby gets all this new stuff and all this attention and all these things, and trying to remember them and doing some special little things for them too is important.
Yep. And for us, it like made this really special moment. I remember when we brought Bo home, and Cecilia was almost 2 years old. She had picked out this stuffed dog for him, and like we brought Bo home, she instantly disappeared, and then comes back with this stuffed animal for her brother. That even as a 22-month-old was like, oh, this was something special. Here's my baby brother. That like again
sweet.
allows them to take ownership and like enjoy like part of that celebration.
Totally.
So then,
Actually meeting the baby
Meeting
when
the
you get
baby.
home. And some people it's not COVID times anymore, so you may bring your kids to the hospital to meet the baby.
there's lots of opportunities for this. And I
Yes.
think a lot of it depends on what your family structure looks like, how much help you have.
Yep.
Key thing is, as much as you can do neutral spaces
Yes.
and like neutral kind of holding or who has the baby, if you can.
you can.
What do we mean by that? So neutral spaces. So if the child can come to the hospital, that's great. Or if you're going to do it at home, do it out in the main room. Do it in the living room, someplace else, rather than like in something that like try to be as neutral as possible.
Yep.
And then what about the neutral holding? What is that? That's the...
Can you have the baby in a bassinet or a bouncer or on a blanket on the floor where mom or dad are going to be hands-free to be able to hug, engage with, love on the toddler, as opposed to like, hey, I have this fresh little baby. I got to keep this baby alive. Situation.
You as parent want to be able to give all of your attention to your toddler, your child first. And so like if baby's safe in a bassinet, then you give your toddler this giant hug, you love on them, and then when they're ready to come say hello, they can. Which for this time was really interesting. Hank came home at like late at night. He was like 10 o'clock. So Bo was already asleep. Cease stayed up super late. She couldn't fall asleep. So she was just like
bouncing off the walls.
I want to see him. I want to touch him. Like I'm his big sister. Look at how cute he is.
Yes.
And then
it was so sweet, and we'll have to show that.
Yeah. And then the next morning, Bo got up. I woke Bo up. Hank was already up with Sarah, and said, "Hey, baby Bo's here." And he came upstairs, and he like wanted nothing to do with the baby. He like wanted to do his normal stuff, and so like he and I like did his normal like first 5 minutes of his morning, and then he was ready to go meet the baby.
Yeah,
and
but
so,
he like walked right by
past
us, went over, got his milk, climbed up to the sink, just totally blew us off. Like didn't even care.
And so I think that's something like every child's different, and so like giving them a little space, like not forcing that interaction, if you can.
Yeah.
So you've done the first meeting, then like, are there any special things for setting up time together for the first couple of weeks?
Yes.
Thoughts about that? I think
one-on-one time with the big kids.
Yeah.
Just knowing that give them some one-on-one attention every day, just them. And it doesn't have to be a lot of time. Give them 15 minutes. Focus
5 minutes even.
on whatever activity they want to do. Don't be distracted. Don't have the baby. Don't be on your phone. Just try to fill their little cup with mom or dad time, so that they feel like they still have attention.
Yeah, and so for us right now we've got 3, and so it's I'll take 2 so you can have 1, and like so like that each kid gets a little bit of special time. Is something that we talk about in developmental pediatrics. Having special time set aside for your kids each day, even if it's 5 minutes, where they get to choose. What are you doing? There's no distractions. And so like really again saying, hey, we have a new member in our family, but it's not gonna like I still love you all of the way. Right? Like
all of the way.
I love you all of the way, I love you all of the way, I love new baby all the way.
Yep.
Like me loving this new infant doesn't take away from me loving you all the way. And then I think the other big thing that we talked about is never blame the baby.
Right.
Right? Like it's really easy, it's natural to say, oh, I can't help you right now. Baby needs my attention, or baby needs me to change their diaper.
Right.
And so what are the words we use for that? Like for diaper, like I'm going to go change a diaper now rather than I have to go change Hank's diaper.
I am busy right now. I will help you as soon as I am done. Or things like that where you're not like, I can't because I have to hold your baby brother or whatever. You're just like, my hands are full right now. I will help you as soon as I can.
Which is it's amazing how natural it is to like say the baby is saying, oh, I'm holding Hank right now, I can't, but no, and just like, hey, my hands are full. And so again, not blaming the baby for them not getting what they want.
And the flip side of that, having the baby wait sometimes. So sometimes you'll be doing something for one of the toddlers, getting the milk, something, and little new baby starts to cry. And so there is an opportunity to say, hang on, baby, I'm helping your big sister do this. I will be right there. So the toddlers also see the new baby having to wait as well. Just so everybody understands, we're going to have to practice a lot of patience right now because you can only be in so many places at one time.
Yep, it's a big time. This comes to the last part of today, this introduction, is having realistic expectations. Like everyone's going to have a lot of emotions. The toddlers, the parents, the new baby, everyone has needs. Everyone's under a period of adjustment. And so a couple things, realize there's going to be big emotions, and realize your kids at home are likely going to have some little setbacks. So what does that mean for us? So we have our son just turned 2. He's been potty trained for 4 or 5 months now and doing awesome. And we've had a ton of pee accidents this week. Or like times where he doesn't use a pacifier during the day ever. And he
steals Hank's.
So like, look, I'm baby, I'm Hanky. Like,
I'm baby. Hold me like baby. Like things like that. And this is a lot when you are freshly postpartum, healing, exhausted, doing all these things, and then you've got to manage this totally new family dynamic of little people adjusting to a new sibling. It can just be a lot. And I know as we've added these kids, you have these feelings of like, I don't have as much time to give to the new baby, or I don't have as much time to give to the bigger kids, or you don't. And that's okay. This is just different. You are enough. You are just what your kids need. And this is just a new, it's just because it's different doesn't mean it's bad.
Yeah.
Like, it's just different, and that's okay.
And I think the beauty of that even is like, even though you each individually have less time for each individual child, like they end up getting moments of love and attention and joy from each other.
Yeah.
And like, this is something that like then just multiplies, right? This is a synergistic effect of the family that like the kids get to love on each other. They get to beat on each other also. And like, that's going to happen. Like, there's going to be moments where you're going to be like, what is going on?
Right. Some of this has been like, we actually have to keep him alive, protect him from his siblings a little bit, because they just don't comprehend how little and fragile he is.
There have been so many beautiful moments, but also please know there are so many moments you're like, please, we have this beautiful baby and just irrational toddlers. Like, life happens. Don't let the crazy steal your joy. Like, just realize it's going to be crazy sometimes. You're going to have beautiful moments. You're going to have trying moments.
Yeah, you're going to have some WTF moments, and you're just like, this is where we live now. We live here, and this is great. And it is different, but it is beautiful. And so just hang in there.
Yeah. So
hopefully,
hopefully it's wonderful for you. Like, again,
if it's not, you'll get there.
Yeah, you'll get there. Think about these again as whether you're pregnant, getting ready to talk beforehand, prep right before, the introduction space, and then really just setting up time for your big kids once you bring baby home as much as you can.
Yes, so congratulations on your growing family. We are so excited for you. Subscribe for all of our other parenting content, and we will see you next week.
Okay, bye guys.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.